Good day everyone, I'm Jasmine Serrano from BSN 1C, and today I will be performing providing bedpan to a patient. So good morning ma'am, I'm Jasmine Serrano, your nurse for today, and today I will be providing a bedpan to you. So first is assessment. Number 1 is assess patient normal bowel elimination habit. So number 2 is perform hand hygiene. I only use alcohol because my hand is not visibly soiled. Then next is osculate abdomen for bowel sound. Then palpate lower abdomen for distension. Next is assess patient's level of mobility. So, ma'am, how is your mobility? Can you move? So the patient's level of mobility is okay. She can move, and I will just assist the patient. Number 4 is assess patient's level of comfort. So, ma'am, can you rate your level of comfort? From 1 to 10, 10 is the highest.
10 po.
Okay, 10 daw. So, the patient's level of comfort is 10. So, we'll now proceed to the procedure. Next is note rectal or abdominal pain, presence of hemorrhoids or irritation of skin surrounding. Next is apply clean gloves. After applying clean gloves, inspect the condition of perianal and perineal skin. Assume that I already performed that. Then remove clean gloves and perform hand hygiene. So I will be removing my clean gloves. Dispose it to the proper receptacle and perform hand hygiene. So, after assessment, we'll now go on to the planning. So, number 1 is identify expected outcomes. Number 2 is explain the procedure to the patient, including self-help tips. Gagawin ko po sa inyo is providing bedpan. Lalagay ko yung bedpan sa may puwetan. Then, kapag kaya nyo po i-move yung sarili nyo, is mas maganda po. Then next is number 3, obtain assistance from additional nursing personnel as warranted. So after planning, we will now go on to the implementation. So number 1 is perform hand hygiene. After performing hand hygiene, provide privacy. So, assuming that I already provided the privacy by closing the door or curtains. So, next, number 3 is raise bed on opposite side. So, assuming that I already raised the bed on the opposite side, raise bed horizontally according to nurse's height. So, assuming po ulit na I already raised the bed on the nurse height. Then, number 5 is had patient assume supine position. So, ma'am, can position yourself on the supine position. The patient is already in supine position. Then, number 6 is place patient who can assist on bedpan. So, letter A is apply clean gloves. Apply clean gloves. After applying clean gloves, raise the head of patient's bed appropriately. So, assuming po na na-raise na natin yung head bed ng patient, So, next is letter B is remove upper bed linens. Do not expose patient. So, remove the upper bed linens. Then, next is instruct patient in how to flex knees and lift hips upward. So, ma'am, ganito po yung pag-flex ng knees and pag-lift ng upward. Itataas yung po ito. Then, make sure that the patient position is in dorsal recumbent. Next is place hand under patient's sacrum to assist lifting. Ask patient to bend knees and raise hip. Slip bedpan under the patient with other hand, then ensure open rim face foot of bed. Then do not force if the patient is cannot able to move. So, ganito po yung una. Do you feel comfortable, ma'am? Okay po. Next is place patient with mobility restriction on bedpan. So, letter A is apply clean gloves. Then next is lower head of bed appropriately. So, assuming that I already lowered the head of bed, then letter B is remove the top linens as necessary. Removing the top linens. Then next is assist patient with rolling into side. Place bedpan on buttocks. So, I will place first the bedpan on this side of the patient. Then, ma'am, I will move you on the side. So, 1, 2, 3. Place the bedpan on the buttocks and down into mattress. Then, ensure open rim face foot of bed. Then next is keep one hand against bedpan and other around patient far hips. Then ask patient to roll into bedpan. Do not force the pan under the patient. So, ma'am, I already put the bedpan, so you will now position on your proper position. Then next is raise patient head properly. So I will raise your head, ma'am. Then next is head patient bed knees unless contraindicated. Then next is maintain patient's comfort and safety. Cover patient for warm, place pillow or towel under the lumbar curve of back. Then stay close by. So, ganito siya. And place the toilet tissue on the patient reach. Next is ensure that the bed was in lowest position, then raise upper side rails. So, let's assume that the bed is on the lowest position, then the side rail of the bed is already raised. Next is remove and discard gloves, then perform hand hygiene. Remove and discard the gloves. Discard it to the proper receptacle. Then perform hand hygiene. basta to and respond promptly. So, I will allow the patient to be alone. So, ma'am, I will be back. This is your call bell or call light. If you need anything else, you can call me by using this call light. So, I will be back, ma'am. Now, the patient is already defecate, so we will now proceed in removing the bedpan. So, first is perform hand hygiene. Then next is apply clean gloves.
Diyan sa kadira pala naman kenday niya.
Then next is place patient's bedside chair close to the working side of the bed. So here's the chair. I will place it to the as beside the bed of the patient. Then next is maintain privacy. Determine if patient is able to wipe on perineal area. Use toilet tissue or washcloth if there is need to clean perineal area. Then clean patient properly. So, maintain privacy. The door or curtain is still closed. Then, if patient is able to wipe on perineal area, use toilet tissue or washcloth. So, this is the wipe tissue. Ma'am, can you able to clean your perineal area? Then next is deposit the contaminated tissue in bedpan if appropriate. Then remove gloves and perform hand hygiene. So deposit the use washcloth on the laundry bag. Then remove the gloves. Then perform hand hygiene. The next is for mobile patient. Ask patient to flex knees and lift buttocks up. Then place hand properly for support. Then help patient lift and remove bedpan. Then next is place bedpan on the draped chair. Then cover the bedpan. So first is ask the patient to flex knees. Flex your knees, ma'am. Then lift the buttocks by supporting the patient's sacrum. The next is remove the bedpan and place it to the chair, then cover it. Then next is for immobile patient, lower head of the bed. Assuming that I already lowered the head of the bed. Then assist patient with rolling of bedpan. Hold bedpan flat while patient roll. Then place bedpan on bedside chair and cover the bedpan. So I will assist the patient in rolling. Then removing the bedpan. Removing the bedpan. Then place the bedpan on the chair, then cover it. Next is allow patient to perform hand hygiene. So, perform hand hygiene, ma'am. Then, change the soiled linen, remove gloves, and return patients to comfortable position. I will change the soiled linen. Hoy, katumon ako.
Isisip ko, di ipapuri sa docs nga release.
Then, dispose it to the laundry bag. Return the patient to the comfortable position. Do you feel comfortable now, ma'am? Okay po. Next is place the bed in the lower position. Then, assuming that I already lowered the bed, then ensure call bell, phone, water, and personal items within reach. So, phone, I will put on this side, ma'am. If you need anything, you can call me. Then next is obtain stool specimen as ordered. Then wear clean gloves when emptying bedpan. Use spray faucet to rinse bedpan. Use disinfectant if required, then remove gloves. So assuming that I already do that, then next is perform hand hygiene. Next, after implementation, we'll now go on to the evaluation. Number 1 is assess the characteristic of stool and urine. So, assuming that I already assessed the characteristic of the stool and urine, then next is evaluate the patient's ability to use bedpan. Next is inspect patient's perineal area and surrounding skin while removing the bedpan. Next is ask patient to demonstrate the use of trapeze. Then number 5 is identify unexpected outcomes. Recording and reporting. So number 1 is record the type of assistance needed, patient's tolerance, character and amount of stool, and urine output in appropriate lab. Then number 2 is complete laboratory requisition. Send specimen to lab, then record the type of specimen sent. So, assuming that I already do that, that's all for today. Thank you. Bye-bye.